Learn about the county's model healthcare plan, convenient family clinics, children's programs, neighborhood and senior centers, transportation services, and more.
Welcome to Hillsborough Health, a series that is devoted to making sure Hillsborough County residents know more about the services available to them. Let's talk about what the healthcare plan is and a little bit of its background, eligibility, and so forth.
Both primary care, preventive care, and moved on to stabilize access for those who unfortunately don't have the means to pay for their own care and who are less than the federal poverty level. And it excluded two populations, the over 65 population because of access to Medicare, and in general, pregnant women and children less than 21 years of age who had access to Medicaid, a federal-state partnership.
This was a model program. And back in, what was it, early 90s, 91, when it was established? Quite a difference it's made in savings, correct?
Making, access to an affordable health care plan for people that don't have insurance or they're in poverty, I think it just makes sense.
Medicare takes care of some of the other folks that might not afford.
Correct.
So the program's considered the payer of last resort, is that correct?
That's correct. If you have any other type of insurance, whether it's Medicaid, Medicare, commercial, any of those, anybody else that would pay for the care, then we would be the payer of absolute last resort. So we fall in those categories where they're 18 to 65 or 64 that are basically adults and they're childless. They don't have families. You have to be a legal resident of Hillsborough County. You have to be at or below 100% of the poverty level. You have to have assets within our established guidelines, which is usually about $5,000. You can't be eligible for any other coverage from any other state, federal, or private insurance. In general, the healthcare plan has been really very, very innovative. It's probably one of the best plans that I've seen, and I've been in healthcare about 40 years.
Now, Commissioner, there's not a pre-existing condition that would disqualify someone, is there?
I don't believe so.
No.
Not that we've seen in the past, but I think what's important about this healthcare plan is that it's an important lifeline for many individuals out there. In our community, we have roughly probably about 25% of our 1.3 million people are lacking health insurance. The economy, of course, made that problem even worse over time. So, it's an important lifeline in our community.
We have had huge savings by moving to a generic pharmaceutical program way in advance of an effectiveness of managed care. And we've also have a patient assistance program whereby for this population, drug companies, through a contractor that we work and we pay for, we basically get the latest pharmaceuticals free of charge for our population. It saves between $8 and $10 million a year. Is that right, Mr. Earley?
Yes, sir.
In that order of magnitude.
We're very excited to announce this. It's a mental health parity. It will be piloted in 4 locations, hospital setting, community, federally qualified community health center, and another, possibly a school site. And we will, when a person walks in, an indigent healthcare client walks in who a physician diagnoses as needing behavioral health services, they will be able to, on site, it will be like a one-stop shop. They'll be able to get behavioral health services on site. And we will, of course, cover that cost of the service. So I think this is an important first step. Another important project we did was we actually are using some of our indigent healthcare money to get the mentally ill inmates out of the jail who are there for just misdemeanor offenses, and get them into services, get them stabilized, back in the community, back with their families. And so we're trying to find very effective, efficient ways of using our tax dollars to really give preventative health care across the way, and really saving on expensive jail services, expensive law enforcement services, expensive hospital services, all the way down the line.
Does the Affordable Care Act get involved in this at all, or do people?
Well, there's a misconception out there that the Hillsborough County Healthcare Plan could be absorbed into the Affordable Care Act, and it can't, primarily because we only treat the clientele or the clients that are not eligible for the tax subsidies or credits that you get out of the Affordable Care Act. So in other words, anyone under 100% of the federal poverty guidelines
Yes.
would not be eligible for any of those tax subsidies that you see or any of the tax credits. And what that means is they would have to pay full price for health care, and obviously this is the most vulnerable population in Hillsborough County, and they could not pay for it.
We're trying to bring together and integrate at a single site of service the mind, the body, and it will produce real savings and actually improve function for many of our clients.
We are about making our community safe and healthy, and we want everyone to feel like they can turn somewhere for care if they need it.
Apply. If you're eligible, apply for this program. It's a great program, and we want to help.
Appreciate all of you and what you're doing and how you're trying to help our community. Thank you for being here and explaining everything to the viewers. And I appreciate the viewers turning in, and we'll see you next time on Hillsborough Health. Thank you.